our vision at M42, the nuances in the words. So we are focusing on health, not care, and we're focusing on people, not patients. Two themes there to pull out really. One is care is expensive, and care is not best for the patient. So prevention is better than sick care, as lots of us know. And focusing on people, not patients, again, better for communities. We're very lucky where we are in Abu Dhabi in particular, and we've got support from the leadership to put generational interventions in place. We can take decisions now that are going to impact health that may have 10 or 20-year impacts down the line. I'll touch a little bit on some of our colorectal cancer program at the moment, which has that cost-benefit analysis. As I mentioned, we're headquartered in Abu Dhabi. We're the largest healthcare group across the Middle East. We're in 25 countries globally now. About 60% of our business is the UAE. Roughly 23 to 25% is Europe. So how do we approach? On the right, these are two of our North Stars and non-negotiables around patient care. So elevating, first of all, the regional UAE and Middle Eastern healthcare landscape is incredibly important to us, ultimately to drive better patient care and improved healthcare outcomes. Over time, we are looking to take those outcomes and those data-driven insights to the rest of our group around the world. We start our journey really with our data inputs. So we have a genomics program, we have centralized electronic healthcare records, we have an environmental sciences group, we look at the insurance claims data, and we have the longitudinal long medical data inputting as well. We have developed in-house technology around those four verticals there. We've augmented that with support from our partners, people like Microsoft, NVIDIA, and Cerebrus. Ultimately driving insights to focus on our North Star. In the center is what we call our flywheel. If we get it right, and we are able to elevate the cost of quality of care using data, that creates like a self-perpetual cycle for us. We believe that patients will come back, and that generates more data, which refines the process going forward. I won't take you through everything on this slide, but if you look at the top, there are some of our legacy healthcare provision group, focusing on care across the globe, and particularly in Abu Dhabi as well. Also within our portfolio, we have a clinical research organisation. We have an environmental sciences group. We have a healthcare diagnostic and screening platform. We have a genomics profile, and we have digital health as well. On the left-hand side of the screen, you'll see there's some more classic corporate KPIs, which I won't read, but the message to take away is that we have high quality and high acuity care. So that's our cardiac program, our transplant program. More, I think, relevant for today and more exciting for myself are some of the data points on the right. So we have a substantial genomic sequencing capability in Abu Dhabi. We can sequence about 55,000 samples a month, which is about 3 times the average for other communities. To date, we've sequenced about 565,000 Emirati genomes, and our target is 1 million within the next 18 months. I'll take you through shortly some of the insights we're getting from that program and how we're labeling them into care as well. Within our network, we have 8 million unique patient records. And again, combining the genomic data and the patient record data is incredibly powerful and insightful going forward. Insurance claims, so we understand where people are claiming, why they're claiming, and understand that cost element of care going forward is really important for us for sustainability. And then you'll see, I think one of the most exciting groups for me, but one of our smallest, is currently our wastewater monitoring division. So we take wastewater samples from every manhole in Abu Dhabi on a weekly basis, and we put them through our testing processes, whether that's genomics or bacteria or whatever that may be, looking for disease, potential population health issues as well. Over time, we're going to look to augment that program to look at air, soil, and maritime as well, while we look at the wider determinants of environmental factors that we talked about earlier today and how they impact health going forward. Pulling that all together at the moment, we have 100 petabytes of data assets. And as a commercial group, we're also looking at how we can actually monetize that, to put that cash back into the system to generate more solutions. Quick double click on our provision business. So we started in the healthcare provision side about 18 years ago, and that was a partnership with Imperial College London, really focusing on diabetes. We have about 63% market share of the diabetic population in Abu Dhabi, and like the rest of the world, Abu Dhabi is not spared from the obesity pandemic. We have effectively the cradle-to-grave offering system here. So we start with creating the baby through IVF, right through mother and child, adult specialities. The pinnacle of our complexity is Cleveland Clinic Abu Dhabi. That's been up and running for about 7 years now. It's the first time that Cleveland Clinic US stepped out of the US system, and they established a partnership in Abu Dhabi. We're very proud of that partnership. Our most recent partnership or acquisition is with Diaverum. So we're number 3 in the world now for kidney care. And that's a global business. Right through to end of care and palliative, underpinned by telemedicine and diagnostics as well. So more of a conventional healthcare network. The question for us now is how do we augment that with our data side of the house? We look at our data in 4 verticals. One is the more classic clinical data, whether it's genomics, whether it's biobank, whether it's patient records. We have the non-clinical data. As I mentioned, we have the insurance claims data, and we have the phenotypical data as well for the patients as they go through their journey in Abu Dhabi and across our dialysis group. I'll spend a minute or two on pillar 3 and 4, because these I haven't touched on. So on the patient side, there was a theme picked up earlier around remote patient monitoring and taking patients out of the more high acuity setting and putting them back into the community. Better for the system, better for costs, better for patients, better for families, if you can do it right. We've got a 300 patient program at the moment that's been running for almost 12 months, where we are proving to the Department of Health and the Ministry of Health where we live that you can do this safely and generate good outcomes and ultimately cost savings to make the system more sustainable. As well, we've got a microbiome capability and also a proteomics capability as well, that was not mentioned. I mentioned here on the environmental science side, we'll touch a little bit more on ESG maybe at the end, but for us, understanding the population health and environmental factors are critical going forward. We're a relatively small country, we're about 11 million people, so we can start to make interventions on the environmental side and understand the determinants of health, and then effectively take those data-driven case studies to our partners internationally. This is just another graphic of how we're augmenting technology, and in particular our tech vision. I'll focus on the top line. So the theme that David picked up around the nursing crisis and the burnout that we see within the NHS and other platforms and systems around the world. So how can we use technology to support our doctors, whether it's clinical decision making, and there's various support tools, whether it's using our radiologists now have their workflows prioritized by AI. We have about 97% accuracy now, so we can't substitute the radiologists, but we can augment the way that they look at their priority cases. We developed a 70 billion parameter clinical large language model in-house as well, which before a patient sees one of our doctors, it takes all the various electronic healthcare records from Abu Dhabi, brings it into one diagnosable, very, very focused report for our doctor, as opposed to him or her having to look at 6 different systems to get the results, and gives them decision support tools. On the precision side, we've got some active programs using genomics and pharmacogenomics, which I'll tell you about shortly. And as I mentioned on the right, we're a commercial organization, so we're actively looking with Big Pharma about how we can monetize some of our data sets on an anonymized basis that generates more capital to put back into our system to do more of the good work. Here's an example of a case study in pharmacogenomics. So as I mentioned, we've sequenced about 565,000 Emiratis. We've now appended to their electronic healthcare record their pharmacogenomic report. So when a patient goes to see their doctor, if the doctor at point of prescription is deciding to prescribe some type of medicine, he or she will get a flag in the system that says, have you considered looking at the genomic profile because of 1, 2, 3? God forbid it's toxic, or equally it may just not work based on the clinical information and genomic information. Again, generating higher quality care, more safe care, and ultimately better cost for the system. Again, with the genomic screening, we can look at intervening earlier around higher risk groups, in particular if they show maybe one or unfortunately two of the colon cancer genes. Because we've sequenced, and we will sequence the majority of the UAE national population, we can get in there early. It may cost us, for example, at Cleveland Clinic, $300 or $400 to do a colonoscopy, and we can maybe do that now and intervene now. Whereas, God forbid, in 20 years' time, they have colon cancer and it's $25,000. So we can make generational decisions now using our technology tools to intervene, save patients' lives, and save money. I was going to finish with a little bit around ESG. So COP28 is very important to us. This is the first time ever that health globally has had a dedicated day, and they put it on the first day of the event this year. Historically, it's been dominated by a big pharma, but this year they're bringing a healthcare provider, a healthcare technology group to the fore, so we're very excited. A few stats here. So if healthcare was a country, it would be the 5th largest emissions emitter globally. Again, not a stat that was widely published, and a lot of that relates to a lot more around the pharmaceutical side, but it's something that we should be aware of within the health industry. And again, as you see here, environmental factors do take a number of lives every year. Getting on that preventative journey, that precision journey, using technology, and a point that a lot of the panelists today have mentioned around education. Again, how do we inform and educate our populations to really drive sustainable care? I've selfishly put my email address on there. You know, we're very focused on partnership, and we are early in our journey. You know, as I mentioned, our healthcare delivery group has been operating for 18 years. We brought together our technology group only 1 year ago. So we're just on that journey now to build that modern global health system. So happy to discuss partnership needs.